you. I have a few questions that I'll ask first, and I'll open it up to my colleagues here. Are there doctors that are prescribing CBD oil at all now in Wisconsin?
We cannot prescribe CBD oil right now. I think there are concerns with the FDA as we've spoken about here. And I think there is concern not only about the efficacy and the side effects, but also the legality of these drugs.
Do you know of any clinical trials that are going on in Wisconsin right now?
At this point, I am not aware of that, but I also did not look into that.
Does the medical society support other supplements like glucosamine? Is that something you guys support, or you don't support?
Well, we wouldn't necessarily have a position on that. In general, what our hope is that we have the ability to prescribe things that have gone through basic safety assessments. So we generally, it's very rare to use something that's not approved by the FDA because we do believe that does lead to further liability and other issues.
Well, the reason I ask is I think there have been studies that have indicated that that is a placebo, and yet a lot of people swear by it. I know my father-in-law is 80-some years old, and if he doesn't take it for a couple days, he has trouble moving. He takes it, and he's like, I have to work to keep up with him.
Yeah.
So it seems to work for him.
And that is, I think, ultimately what it comes down to, being able to have a risk and benefit analysis as far as the risks. If your possible benefit with that outweighs the risk, and I am not aware of great risk at this point for the supplement that you're discussing, but you do have to weigh the risks and benefits, and the problem with signing off on something like this where we do not have the risks well delineated, let alone the benefit well delineated. There are treatments out there that one person certainly might respond to, whether it's placebo or whether it's efficacy or not. That doesn't necessarily mean that we feel that everybody should have an open shot at that, because there could have been something else going on in that case, and it may work in nobody else, just that one person.
Oh, and I appreciate that. I guess when we look at balancing things, I know when I go and see my doctor, he questions me. He asks me about the medications I'm on, and I'm not going to go into my medical history. But he questions me about the effectiveness of the medications that I'm on, and do I feel that it's helping with whatever my issue might be. And then from my interaction, he provides me information on where I should go next, or what his recommendation is, because doctors are quote-unquote practicing. It is something that is constantly changing. And I guess my question is this: the negatives that we would have with CBD oil that we've heard so far with some of the testing done in some of the, I think it's 5 states that have done the testing. I'm sure we'll hear some testimony on that. But I know 20 states have passed this being able to be utilized. If I have a choice between having to take my child in and have brain surgery or try CBD oil, I don't think that, I mean, to me that is, there's no question. I should be able as a parent to be able to make that choice, because brain surgery is a whole lot different, especially if all of a sudden, like we heard testimony here, the brain surgery didn't help and my child is back in the same thing. So I guess my thought is this: I don't think any amount of medical research will necessarily always tell us everything. I do appreciate the FDA coming forward with some of these things, but in my testimony I also spoke about, we have aspirin that is pretty good analgesic that eliminates pain, yet we've created all these other synthetic things to replace aspirin that have all these multiple side effects. I mean, you know, and then we don't go back to aspirin. So something that's really simple like this just makes me question, you know, why are we not looking at the patient and allowing the patient to make some of these decisions, especially when we have such a catastrophic event occurring in the family. And I think this is what is a little different here. And I mean, I understand that there's challenges with determining the pureness of the CBD oil and the multiple purification processes that some of these different companies go through. But I think that's a choice of the individual parent to have that research available, and to us make it available here so people can be educated about it. So can you just give us a few comments on the whole list of things you just gave?
Yeah, sure. And again, I think we certainly support patients being involved in their care and having data that's available. I think our concern in this case is the data isn't available yet in a sufficient form. Now, maybe the data that we need as a physician to be able to stand behind it, or as a medical society to be able to endorse something, might be different than the amount of data needed from a parent who is making this decision. But I can only speak from the medical society perspective, and we just do not believe that the data is there for you to be able to make an informed choice of risks and benefits with the medication. And, you know, obviously, not to get too much into this, because I'm a psychiatrist, not a neurosurgeon, but there have been people that have responded very well to brain surgery in these cases. And sometimes the idea is very, you know, but I'm also a psychiatrist. I've implanted devices in brains for depression and anxiety, so I'm a little more comfortable, but that is certainly within the realm of practice, and there is data, and there's data behind it. It's an evidence-based practice, and these are evidence-based procedures that are being used. So I would once again separate that from the CBD oil, right, where I do not believe there is sufficient data at this point for us to recommend it. But that, again, that could be a very different level of data necessary for a parent wanting to do that versus as a medical society saying that it's a reasonable thing to do.
Just one other question or comment here. I have a friend that has Parkinson's that is pretty well along now, and he's a few years older than I am. And he routinely has to go into the hospital for a, what do they call it, bringing them back to having nothing in their system and then readjusting the levels. I'm not sure what the technical term is, but they basically come in and they zero out his body and wash him out, right, get it out, and now they try something a little different to see if that's going to work. And I know that we have spoken about this, and if he had a choice of having surgery or trying something that is some people might say is a placebo but might work, he would rather try that first as opposed to going in and having a surgical procedure. So I mean, how do we tell the parent and speak to the parents that are here with these kids that, and this is been tried in other states and has been successful, and I don't care if it's 1%. If it's my kid or my nephew or my granddaughter or my son, I would want to try it just to see if it's going to have some kind of effect. So what do we tell these parents? So especially when it's been done in 20 states.
Yeah, you know, I mean, medical science does not have all of the answers, and I think that's pretty clear to everybody in this room. And I would imagine behind every one of these families that have had a struggle, there is at least one, maybe more physicians that have been working very hard to try to get their family well. But again, all that I can say from our perspective, I can understand how an individual parent's perspective might be different.
Sure.
But from the perspective of risks and benefits, going over the risks and benefits, if you do not have a full accounting of the risks, let alone the benefits. I mean, so there are things out there that can work in people, as you said, placebo, whether that's what's going on here or not. I am not saying that, but there are things that can work in folks. It doesn't necessarily mean that it becomes something that we recommend that everybody try.
So you're not speaking against this as that it's a negative and that there have been all these things that have been negatives against this. This is basically that it's just not known.
That is exactly what I'm saying. We're
Okay.
saying that the data is not there to support this as a treatment that we recommend.
Okay, let me open it up to the other senators, Senator Risser and then Senator Taylor.